The first thing I'd like to say is to Minister Butler, I'd like to thank her. Bottom of page 3 of your contribution, again, people with mental health difficulties, including schizophrenia, bipolar disorder and severe depression being included in the booster vaccine, and a special emphasis on that. You did that previously with the first round of the vaccine as well. I know you get how serious this is for people who are living with those conditions. Only in the last couple of weeks, I heard of another story of an individual who won't be captured in the overall figure of 5,609 of someone who died with COVID. But they passed because of COVID, because they suffered one of these illnesses. There was direct correlation. And I'm thinking of that person now when I'm making this contribution. I'll be thinking of them for a good while to come. So it's vitally important that these people are reached as soon as possible and are offered the booster, and every effort is made to get them to a vaccination centre. So thank you for that. Minister, following on from leaders' questions yesterday and my discussion with the Taoiseach, our greatest concern here in the Labour Party is that we're operating as if this wave is going to be our last, and I think that's something that we've been doing in hope, in positive hope, I think, since this pandemic began, that with each wave that comes, that it will be our last. But unfortunately, this virus continues to outwit not only ourselves, our region, but the world. So we have to plan, as the WHO are saying, for this virus being with us until at least 2023. And it means putting in place the resources to cope with surges in the need for testing, for vaccinations, boosters, down to critical care beds. And that's where we need to look. While we're in the eye of the storm, which we are now in this fourth wave, and we can get caught up on a day-to-day basis with what is the issue of that day, the individual crisis within a crisis of that day. But we need to be talking about how we are going to make our health service robust enough to ensure that we can mitigate against these waves should they come. And hopefully this is our last wave, but we can't plan for it to be. So I want to ask about ICU capacity. Paul Reid said today, you mentioned there that we would have a baseline of 297 ICU beds. We know that the target from the own department's 2018 capacity review was that would be 330, but we're at 297 for the end of 2021. Paul Reid said we'd have surge beds of 50 surge beds for December and into the early part of the new year. Can you, in your summing up, indicate how many whole-time equivalent hours that's going to take from non-COVID care and how that's going to impact on non-COVID care? Because surge capacity has an impact on non-COVID care. So if you could detail that or provide details of that, because we know that providing ICU beds is not rolling in a bed into an ICU ward. There is skilled, well-trained staff that need to go with that bed, and whether it's myself or other spokespeople, we are fully aware of that. So surge capacity does have an impact on non-COVID healthcare, and non-COVID healthcare is in a crisis too. On PCR testing, we know there's issues. I've been raising this now for over a week and a half. It can be 2 days to get a test. It can be 2 days then to get your result. 4 days from when you might feel symptomatic to when you get your result. For people like us in this house, we have an ability to control our diaries. We have staff that work for us that can keep the wheels going. But if you're working in retail, if you're working as a taxi driver in transport, or in low-paid work, you don't have that luxury, and you're under pressure to work. The pup has been cut. That has to change. Where we're going with this virus, that has to change, because we are having low-paid workers coming into the Christmas period under immense stress to pay fuel bills, to pay rent, and this 4-day delay, we have to minimise it. We're doing 209,000 tests a week. That's substantial. I'm not saying that. I really wish we didn't need extra capacity on top of that, but we do. On antigen testing, there has been a hames made of it. The opposition have been criticised by the government for being partisan or whatever it may be. But over the course of this pandemic, the opposition have provided practical solutions in terms of antigen testing, in terms of test and trace, not cutting the pup, sick pay, and in terms of remote work. The opposition have been playing a very constructive role, and we in the Labour Party have been playing a constructive role. On antigen testing, I would like the Minister's response to this. Where does he see antigen tests? What role does he see antigen testing playing in households into 2022? Where antigen testing has worked this year and back into last year is where usually large companies or big building companies have made sure their workers have been serial testing. Mondays and Thursdays on the big sites, and they've been catching cases and they've been self-isolating, and work has been able to continue. The Taoiseach yesterday said he sees a role, in response to my question on Promise Led, he sees a role for regular testing in households into 2022. Do you think that's the case? If it is, how do we get clear messaging, and how do we get accessible, affordable, ideally free antigen testing into enough households to ensure that we are catching this virus as early as possible and making sure it's spreading as slowly as possible? Because as Dr. Catherine Motherway says, she believes that everyone in this country is probably going to get this virus. We have to slow the spread. We have to take the pressure away from our acute hospital systems. Thank you. I look forward to your summing up. Thank you.